I'm Megan. I'm a physical therapist assistant student. How are you doing?
Good.
Good. Before we get started, can I get your name and birthday?
Jackie Stork, September 10th, 1995.
Nice, thank you. How have you been feeling lately?
Okay.
You've got, this says you've got some lower back pain, right?
Yeah, it started when I was like bending over to like pick something up. It just kind of like came up and it hurt.
Alright, what's your pain level today?
Probably about 3 or 4.
Good. And what makes it worse? What makes it better? Do you know?
Sometimes like during the day I'll kind of like that, like twisting it and it bugs me.
And that makes it hurt worse?
Mm-hmm.
Alright, well, so as a physical therapist assistant student, my role today is to, I'm under the direction of the physical therapist, and I am going to help you through your exercises today. Do I have your consent to treat?
Yeah.
Alright, thank you. So today what I'm going to do is I'm going to show you this traditional lift. So I made this handout, but you can take this home after.
Okay.
So what we're going to do is you're going to face the object with the feet staggered on each side of the box. I'm going to teach you how to lift it with proper body mechanics, get that lower back feeling a little bit better. Then you're going to lift the object off the floor, keeping your back straight, arms straight, shoulders parallel, head forward, and then you're going to use your legs and your hips to stand up. We don't want that bending in the back. But before we do that, it's kind of a two-step process. So I'm going to show you something to kind of stabilize your core a little bit. So we're going to teach you the pelvic neutral, pelvic tilt. So can you feel those hip bones that kind of stick out right in the front? Yeah. And then if you come back, got little dimples back there.
Yeah.
That kind of poke out. So what I'm going to have you do, so your pelvis rotates just like this.
Okay.
So I'm going to have you come, rotate that pelvis forward, stick your belly button out. You feel that?
Mm-hmm.
How it kind of rotates forward,
Yeah.
and then I'm going to have you go clear back, hunch over.
Okay.
And then for the neutral, I want you to come right in the middle, and it should feel pretty comfortable.
Yeah.
No pain.
Mm-hmm.
You found that? And I want you to concentrate on keeping your core tight.
Okay.
Flex those abs. And then one more thing I'm going to show you before we get to the lift is it's really important to keep your back straight as you're lifting. That causes a lot of injury. So what I'm going to have you do is you're going to take this cane, hold it back here in your back,
Okay.
and then up behind your head. And what you don't want is your backhand to come off your back. So you want to make sure to keep your back straight. So you're going to bend at the knees and the hips.
Okay.
Does that make sense?
Yeah.
Alright, I'm going to have you try that, practice that a little bit. Yeah, try it one more time.
Okay.
Perfect. Okay. And then keeping that pelvic neutral.
Yeah.
Cool. Alright, so next, what I'm going to show you is the lift. How to lift the box. It's called the traditional lift. And it's mainly used for picking up heavy objects off the floor. And if you have bad knees, a lot of people like this feels a little better than bending all the way down. So what you're going to do, you're going to stagger your legs, like I said. Bend over, keeping that back straight, shoulders forward, head forward.
Okay.
Pick it up, keeping the object close to your body, and stand up with your legs.
Okay.
And then you're going to put it back down the same way.
Okay.
Will you repeat back to me the steps that
Yeah.
It
So
just-
I want to
Sure,
keep
you-
my feet forward, staggered. I want to keep my back straight with my pelvic neutral and my tummy tucked tight.
Mhm.
I want to keep my head forward, my shoulders straight, and then when getting the box, putting it closer to my body as I come up.
Mhm.
Does that sound good?
Yeah, that sounds perfect. Let's have you demonstrate my little system.
Okay. So I stagger, keeping everything straight, my back straight,
Perfect.
okay, and then just the same way down.
Yeah.
Okay.
How does that feel?
Yeah, that feels good.
Does that feel good? Do you think you can practice that this week and
Yeah, definitely.
practice that pelvic neutral, keeping that core tight?
Yeah.
Alright, perfect. And here's this, just in case you forget.
Awesome. Thank you. Okay, thank you.
Thanks.